So hello students, our today's topic is dentin. What is dentin? Dentin, it is a hard tissue that forms the bulk and gives form and shape to the tooth. So dentin, so basically we have four structures: enamel, dentin, cementum and the pulp. So dentin, it is covered by the enamel in the crown and the cementum in the root, and it consists of pulp that surrounds it. So the color of dentin, it varies from light yellow in deciduous teeth to pale yellow in the permanent dentition. So what you will see is in the deciduous dentition the color is light yellow, but in the permanent it is pale yellow. So it becomes darker with the age. So which is more radiolucent, enamel or dentin? Yes, the dentin is more radiolucent. Why? Because of the lower content of the mineral salts in the dentin. It is less hard than the enamel, but more harder than the bone or the cementum. Dentin, it is harder in the permanent teeth than in the deciduous teeth. The dentin, it is mildly elastic in nature, so it will support the brittle enamel under the masticatory force. So what is the composition of the dentin? The dentin consists of 65% of the inorganic matter and 35% of the organic matter. 65% of the inorganic matter and the 35% of the organic matter. That is by weight, and by volume dentin consists of 45% of the inorganic material and 33% of the organic material. So what are the inorganic component of the dentin? The inorganic component that is made up of hydroxyapatite, that is the hydroxyapatite, they are rich in carbon, poor in calcium, and are smaller in size as compared to the crystals of the enamel. And the organic component, it is made up of collagen fibers, that is predominantly made up of collagen fibrils. Which fibers? Type 1 fibers. Type 1 fibers, they are present in the dentin, and the ground substance, it is made up of mucopolysaccharides, glycosa, aminoglycans, proteoglycans. The hydroxyapatite of crystals of dentin, they are much smaller than the enamel. So what the dentin contains the dentinal tubules that follows a gentle curve in the crown, less so in the root. So it will resemble a S or sigmoid in shape. So these are the primary curvatures. So there are primary curvatures, secondary curvatures. So the dentinal tubules, they are sigmoid or S-shaped curvature that run perpendicular from the pulp toward the periphery. Near the root tip, remember these, the root tip and the root tip, incisal edge and the cusp, these dentinal tubules, they are straight. The first convexity of the double curved dentinal tubule is toward the apex of teeth. So you can see the S-shaped dentinal tubules. So near the root tip, incisal edge and the cusps, the dentinal tubules, they would be almost straight. The diameter of the dentinal tubule is larger at the pulpal site than at the dentino-enamel junction. The number of tubules per unit area at the pulpal end, it is 4 to 5 times more than that at the outer surface. So the ratio between the outer and the inner surface of dentin, on average, it's 5:1. So the tubules, they will be widely separated at the outer surface of dentin. They are crowded near the pulpal cavity. So the root dentin, it has lesser tubules compared to the crown. The dentinal tubules, it show more branching at their terminal parts. So this is the figure of the dentinal tubule showing S-shaped course, but at the incisal edge and the root of the tooth and in the root of the tooth course of dentinal tubule, it is straight. So you have to remember two things. The ratio between the outer and inner surface of dentin is 5 is to 1, and the ratio between the number of tubules per unit area of the pulpal and the outer surface of dentin, it is 1 is to 1. Now, what are the organic components in dentin? The major component is the collagen. Which collagen? Type 1 collagen predominates. So, what is the function of collagen? It plays a role in initiating mineralization. So, it gives a structural framework for the dentin that gives the strength and resiliency to the dentin. Other are the phosphoproteins. Major non-collagenous proteins are present. The major proteins, they are dentin sialoprotein and dentin phosphoprotein. So their role is they play role in mineralization. The third is proteoglycan. What are proteoglycans? They are dermatan, chondroitin, keratin sulfate. These are the proteoglycan. So they will also control the mineralization process. The third is the gamma carboxyglutamate containing proteins, matrix GLA and bone GLA osteocalcin proteins. So they can bind calcium, suggesting that they may initiate or control the mineralization process. What are the acidic glycoprotein that is present? It is osteopontin. The osteopontin, it may be associated with the odontoblastic processes, serving as a link between matrix and cell membrane. Growth factors, transforming growth factors, beta cartilage, insulin growth factors, these are present. So when injury occur, these helps in proliferation and new odontoblast, differentiation of new odontoblast and proliferation of them. So they control the proliferation and differentiation of the new odontoblast. So these are the organic content that are present in the dentin.
So let us discuss the types of dentin. The first is the primary dentin. So this dentin it is formed prior to the complete eruption of the teeth. So prior to the complete eruption of the teeth and tooth completion, the dentin that is formed is primary dentin. So remember, it forms the major bulk of dentin. The primary dentin it is composed of mental dentin and circumpulpal dentin. What is mental dentin? Mental dentin it is the first formed dentin in the crown close to the dentino-enamel junction. So the first formed dentin in crown close to the dentino-enamel junction is the mental dentin. So this mental dentin it is bounded by interglobular dentin and dentino-enamel junction. It is less mineralized and lacks loosely plaqued. It is less mineralized and is approximately 150 nanometer wide, whereas the pulpal dentin, circumpulpal dentin is the dentin that surrounds the pulp. The primary dentin that surrounds the pulp is the circumpulpal dentin and forms the bulk of the tooth. As compared to the mental dentin, the circumpulpal dentin will contain slightly more mineral as that of mental dentin. So it represents all the dentin that is formed before the root completion. What is the dentin that is formed after root completion and the complete eruption of the teeth? It is the secondary dentin. The secondary dentin, as compared to the primary dentin, will contain fewer dentinal tubules. A bend is seen at the junction of the primary and secondary dentin. The secondary dentin it grows slowly and reduces the size of pulp with the age. So this secondary dentin it is deposited at the periphery of pulp. There is greater deposition of this secondary dentin on the roof and the floor of the pulp chamber. So because of this, there is asymmetrical reduction in the shape and the size of the pulp chamber. So these changes can be seen in the radiograph, that is the pulp recession. What is the reactionary dentin? So like in cases where there is caries or exposure to the operative procedures like abrasion, erosions, if the odontoblast they get survive, they will produce a dentin. This type of dentin is the reactionary dentin that is produced as a reaction to the in response to the caries, abrasion or adhesion procedure. It is also known as reparative dentin, tertiary dentin. So the newly differentiated odontoblast will deposit this reparative dentin, and it helps to seal off the area of the injury. So there will be a resolution of the inflammation, and slowly there will be removal of the dead cells. This reparative dentin has lesser and more twisted tubules as compared to the normal dentin. So there are two types that could be reactionary dentin formation or reparative dentin formation. Reactionary dentin means the pre-existing odontoblast. The reactionary dentin is formed by deposition of the pre-existing odontoblast that have survived the injury, whereas the reparative dentin is formed by deposition of newly formed odontoblast-like cells. What is sclerotic or transparent dentin? So what you will see, the excessive formation of collagen fibers and hydroxyapatite crystals in the dentinal tubules can lead to obliteration of the dentinal tubules. So that may be considered a defensive reaction of the dentine. So what you will see is the tubule lumen, it is obliterated with the mineral, and this sclerotic dentine, the amount of sclerotic this dentine is increased with the age. It is where it is present, it is mostly present in apical region of root below the treated cusp. So this dentine will appear dark in the reflected light and transparent in the transmitted light. It is mainly seen in the patient of the elderly age patient. You will see mineral density is greater here. What is the interglobular dentine? It is the area of unmineralized or hypomineralized dentine that persists within normally mineralized dentine. So it is seen in teeth in which there is deficiency of vitamin D or exposure to high level of fluoride during the dentinogenesis. So sometimes mineralization of dentine, they begin in small globular areas. Sometimes the mineralization of dentine, it occurs in small areas that fail to fuse into a homogeneous mass. So that results in irregular area of the hypocalcified matrix, that is interglobular dentine. Generally seen along the incremental lines, especially in the crown of teeth, in the pulpal dentine, below the mental dentine. Now let us discuss the structural lines that are found in dentine. The structural lines relate to formation of the dentine. They are known as incremental lines or imbrication lines. The other type of lines, they are related to curvature of the dentinal tubules. It includes the incremental line of von Ebner. So these increment line of von Ebner, it shows the daily arithmetic pattern of the dentine matrix. So they are seen at fine lines, they are seen at the right angle to the dentinal tubules, and these are known as incremental line of von Eber. So as you know that dentine formation, it is a arithmetic process. So there is alternate period of activity and inactivity. So these phases are represented in the fully formed dentine as incremental lines. So that represents the daily arithmetic pattern of the dentine matrix. So the course of these lines shows the growth pattern of the dentine. Some incremental lines may be seen due to the disturbance of the mineralization, that is known as contour line of Owens. So that lines indicate a phase of mineralization followed by outer contour of the dentine. So these are seen in ground section either by doing microradiography or using a demineralized section.